Hello and welcome back. My name is James and this is That Med Guy. I just want to quickly say thank you for watching. It really does encourage me to keep on making videos, and if you hit that like and that subscribe button, it also really just encourages me to continue making more and getting crazy about and just making more videos and sharing the good news that is medicine. So what are we doing today? Well, we are discussing three points of advice I wish I knew when I was starting. From when I was a student to when I was newly qualified, these are just three pieces of advice that would have changed the way I saw a lot of things. So number one is that we learn by doing. I know that sounds bizarre, but because I'm busy doing my master's in medical education, I'm learning more and more that we don't learn by reading, we don't learn by studying, we don't learn by writing tests, we learn by doing. There was some guy who wrote it in a textbook a couple of years ago, Graham or something. And so what I mean by learn by doing is that when you're studying the medications, or you're studying how to do something, or you're learning how to do an RSI, really the way you learn to do it is you do it. Really, we need to be doing the things that we're learning. So you can parrot fashion study a drug textbook, like I'm sure most of us did when we were students, only until you actually give that drug do you now be like, okay, I actually need to know what I'm doing, and it kind of changes the whole thing. So focus on, yes, study is important, but really focus on doing. Do more shifts, do more practical, just do as much as you can. The next point of topic that I wish I knew was that as students, we don't make decisions. I know this sounds bizarre, but while we're working with other paramedics, or while we're in hospitals, or whatever the case is, we don't make treatment decisions, or we don't make decisions on how to treat patients. And this is a massive handicap, because we all qualify, and the next day we are now go from student to fully blown paramedic, and we have to go from never having made a decision to now making all the decisions, and people looking up to us to make those decisions. And so the reason why this is really useful is for, well, one, if you are a student, that you need to try and ask the people you're working with to let you make decisions. So making diagnostic decisions, making treatment decisions, making dose decisions, not just having the paramedics say, hey, can you please give 5 milligrams of morphine? Or hey, we're gonna do an RSI, can you please prep this? Rather, you walk into the patient and you go, oh, I think we're gonna have to RSI, and that is then letting you make a decision, which then helps you further along. And this lands into the previous point of advice, was that we need to learn by doing. And if we only study, how to diagnose asthma or how to diagnose MI, we really should be making decisions much early on, because when you become a paramedic or a nurse or doctor early on, you'll probably realize, if you haven't had like an amazing mentor or something previously, that you will go into this and say, well, I'm not sure. You'll find yourself doubting yourself quite often, because we're not used to making decisions, which is bizarre. But it's something that you just need to be aware of. And that same goes for now paramedics, nurses, or doctors who have students or have people working under them. Let them make decisions. If you're making all of the decisions, what are they going to do when you're not there? What are they going to do when they're treating your loved one or your friend, and you're actually now moved on, and now they are now the head doctor and they've never made a decision in their life? Allow people who are not at your level but below your level to make decisions. It helps them learn. And then the final piece, which might not fit in if you are a qualified paramedic or nurse or doctor, but if you're working with someone as a student and they don't let you do things, so let's say you have an intubation and they don't let you intubate, or there's a technique or a maneuver or a thing we have to administer and they don't let you administer, it's probably because they don't have confidence in themselves to fix the problem. So don't take it personally if you're working with someone and they say, hey, I'm going to do this intubation, or hey, I'm going to do this chest decompression or chest drain, or whatever the case is. You must realize that the most likely reason that they're not letting you do whatever procedure that they're wanting to do is that because they don't have confidence in their ability to fix the problem. So they also there because they are responsible for what happens, but quite often if things go wrong, so I hand a intubation over to you and you don't get the tube in on the first or second attempt, am I confident in my own ability to fix the problem? And as doctors or nurses or paramedics, when we have people working with us, we need to also realize that we might be hesitant to hand over something to a student or a mentee because we're not quite sure we're able to fix the problem. We need to be careful, obviously, because patient safety is first. And if you're not comfortable or if you're not confident, there's nothing wrong with that, but then we need to learn and grow together. We need to move away from a mindset or a society where we think that saying I don't know or saying I'm not sure is kind of like a taboo thing, and that we need to come across with this confidence and this I know what I'm doing and this, I know everything, I don't need help. It is really, that is not going to work. The fourth thing that just actually came to mind now was that the moment you believe you know everything, the moment you don't take people's input is the moment you stop learning. You cannot move into medicine, you cannot do these things and get to a point where you're like, I know everything. You can't tell me what is right and what is wrong because I know the answers. When we become big-headed is when we start to make mistakes. And when we make mistakes, that's when patients' lives get in the line of fire, and that is not where we're wanting to go. So if you meet people who are just dogmatic, they know the answer, they know everything, and they're not willing to hear your advice or hear what you're saying, just realize that they have just stopped learning, and that the best nurses, doctors, and paramedics that I've ever met in my whole life are humble. They realize their limitations, they know what they can and can't do, and they're willing to call for help. That is exactly what we need more of. So guys, I hope you have enjoyed this, and we'll see you in the next one. Bye for now.